hello, family and friends, and my new friends tuning in. Welcome to the Nubia Suggs Show. I am your host, Nubia Suggs. Well, here's the medical story. The coronavirus done gotten so out of hand, Google in the Bay Area insists that their employees work from home. And I don't blame them. Joining me today is friend of the show, Dr. T, who specializes in functional medicine. Buckle your seats for his insight on the coronavirus. Dr. T, let's keep it all the way 100. Are we all going to die?
Well, we're all going to die sometime, but I don't think we're all going to die from the coronavirus, if that's what you mean.
Yeah, that's exactly what I mean.
Right.
Yeah, the numbers are steady going up and up and up and up.
Right. So the mortality rate is something that we look at scientifically, and we look at case fatality rates as actually the real true number. The real true number is something people aren't discussing on the news, and that's case fatality rate. So case fatality rate from people, younger people are safer, and women are safer, it turns out to be. So it's affecting more elderly men.
Yeah.
Most of these people are what's called immunocompromised. They have other health conditions associated. We're finding out that diabetes, heart disease, COPD, smokers, these type of things are more harder on the person if they would contact the coronavirus.
Yeah.
So it's all about the immune system. So we have to keep our immune system strong. But as far as case fatality rates, it's actually less than 1% in people from around 30 years old to 70 years old.
30 to 70.
So about 80% of all the fatalities so far have occurred 80% of them have been men, and then of that 80%, about 80% have been in people over 75 years old. So it's affecting the hospitals a lot. So a lot of this stuff is being transferred once the person goes to the hospital.
Yeah.
Especially healthcare workers, they're a lot more susceptible because they're around the sick people all the time. Needless to say, we need to be taking extra precautions these days. But we should panic. So the whole thing is people, I think, are panicking. They're hoarding, right? They're hoarding toilet paper. Now it doesn't mean you can't be frivolous and stock up on some supplies and things like that. But what's going on is they're creating a crisis, and a lot of people are actually going into the hospitals and stealing a lot of things too.
Okay.
And they're stealing gloves, masks, gowns.
What?
And the healthcare professionals that actually need this stuff don't have it on hand, and there's starting to be shortage. There's a shortage of it,
and not to mention that some of this stuff comes from China, and we're not sending for anything over there right about now.
Correct. So what we know about the coronavirus is, well, the coronavirus is a RNA virus. So what it does is, picture this as your cell. Okay, this is your cell. And this is it tries to get in your cell.
Yeah.
And it hijacks your cell's machinery. That way it can replicate, takes over. Beautiful, perfect. It takes over your own cell, transfers its RNA into your cell so it can duplicate itself. Without a living host, it cannot survive. It has to have a living host. So it can live, we're finding out it can live on surfaces for a little bit of time.
Okay.
Maybe a little bit longer than the cold virus. Cold virus is a coronavirus also. There's hundreds of different strains of coronavirus.
Okay.
Yes. Or the flu. But needless to say, it only can last probably what we're thinking is a few minutes on like a steel surface or a doorknob or something like that. It has to get into a living host to be able to replicate.
Yeah.
So, disinfect household items is a good idea. Doorknobs should be number one. The number one thing, we're finding that the number one thing, and people don't realize this, that stops the infection from spreading is good old-fashioned hand washing. Good old-fashioned hand washing. Hot water, not scalding, of course, but hot water.
Hot as you can stand it.
Hot as you can stand it with a nice soapy water. So that's what you need to do.
And then I heard one leader say on the news that don't just go in there and wash your hands. Wash it for a certain amount of
20
time.
seconds.
A good amount of time is
20 seconds.
How did he say it? He say, "Oh, sing happy birthday to yourself twice."
Yeah.
And he said, even if you smile with it, he said that'll help. That'll give you a couple more seconds.
Right. So
but, but that little washing your hands, going in there, rinsing your hands out real fast and running back out of there.
Right. The other thing I want to talk about is this little guy right here. You see everybody wearing them, right?
Yeah.
This is a standard.
I got one of those at home.
Surgical masks. They do not work. They do not filter the coronavirus. They're not tight enough.
Yeah, and too much air can seep through.
Too much air can seep through. So the CDC and everybody else, American Medical Association, is warning people, don't think this is going to stop the coronavirus. The only thing this thing's good for, if you are sick, it prevents you from sneezing or coughing on other people.
Yeah.
But it does not prevent you from getting the virus. If you wear it and you're healthy, this won't prevent you from getting it. The only thing that will prevent, is which they don't recommend because there's going to be a shortage, is an N95 respirator mask.
Low key, is Earth under attack with this coronavirus? Hashtag, what are they not telling us?
Well, there's a lot of conspiracy theories out, and one of the big ones I want to dispel this myth right now because I've been in contact with some people at Scripps Institute, and they absolutely tell me it's not a bioterrorism weapon. Okay?
Yeah,
it wasn't made by China to kill off everybody and escape out of the lab. There's only two sequencing techniques that's used when man can kind of mutate these things in the lab, and they can identify if that was done or not. And according to my sources, they checked that, and that was not the case. It was not man-made.
Good.
Yeah.
So am I to understand this right, that the coronavirus travels through the air until it finds a body to live in?
Pretty much. It needs you or I or him. It needs a living host. It cannot live on its own, like I said, out in the open. It has to find somebody to go into.
We're going to share some prevention tips when we come back. We're back, and if you're just joining us, meet Dr. T, and we're about to share some tips for the coronavirus. Now, doctor, I'm going to throw out some tips and you just elaborate on it.
Sure.
Ready?
Yes.
Avoid close contact with people who are sick.
Yes, and that's common sense, but we need to emphasize this, especially with this going around now. So once again, right now I would avoid handshaking if possible. Fist bumps, elbow bumps. Try not to be around someone that's sick. Try to keep your distance. Even hugging's kind of out right now. If you're a hugger, I'd kind of refrain from that a little bit too.
Cover your mouth with tissue when you cough or sneeze.
Yes, so that's a real good thing. We should always practice these things actually all the time anyway. So sneeze and cough etiquette is really important that we don't spread it to other people. So you want to always cover your mouth, maybe have a handkerchief on you. If you don't have one, cough into the old elbow etiquette or something like that. But yes, cover your mouth. Cover your nose when you have to cough or sneeze, for sure.
Cover the old elbows, never go out of style.
Right.
Avoid touching your face.
Okay, so transfer from face to oral nasal area is a big problem too. So you could have it get it on your hands, and then you go to your face, and that's how you get it through the respiration system. So not necessarily the point is it's on your hands. It's when you go to if you happen to have the coronavirus on your hand and then you go to your face, you're going to transfer it to yourself.
Yeah. The number one thing you should be doing more than ever on a regular is washing your hands. And I know you just touched on that.
Number one thing. We can't emphasize that enough. Seems like people just don't get that for some reason. Like I said, the new CDC statistics on how few people actually wash their hands, and for some reason people don't understand. Well, how's that help? Breathing or whatever. But like you said, it's a hygiene thing. It kills the viruses on your hand. Now the other thing about the alcohol, this just to interject here a little bit. So the hand sanitizers aren't as good. They're better than nothing, but they're not as good as old-fashioned soap and water.
That's what I do. I don't even buy hand sanitizer. Right. I keep soap with me in my purse. So if they don't have it in the restrooms, I don't pull out the whole wipes or the sanitizer or gel. I bring my own soap from home and wash my hands.
If the people out there do not have access to soap and water and absolutely necessary, the only thing, make sure the alcohol and only the alcohol sanitizer has to be about 70% alcohol. It has to have a high content of alcohol in it.
Yes.
So, but once again, no substitute for good old-fashioned hand washing.
No substitute at all. No, you don't want to substitute that. If you are sick, stay home.
Hallelujah. Yes, you should be really, have feelings for other people. And if you're sick, it's good common sense that you don't want to go out and spread this thing. Stay home. I know sometimes people get antsy, but just stay home till you're better. And that way you're not going to spread it to other people. And even at the gym, I see a lot of people cough and sneeze, and I'm like, oh man, why don't you just stay home today?
Right, my goodness.
Right.
One of the popular questions that people always ask, can you contract something from making out with your soulmate or loved one or friend with benefits, whatever you want to call it? That seems to be some popular question. And I take it that the answer is no. Like, I'm no doctor, so, but I want to say that the answer is no.
Correct. And that's a very, very good topic. You brought that up, because that's probably one of my most asked questions is, I had a guy message me today if he could have sex. And I said, well, if you're having sex with strangers, that constitutes close contact, being intimate. And you can definitely get it from kissing, into any kind of intimate contact. You just don't know these days. So, it's good practice not to do that anyway. But I'm just saying, especially now, you really want to avoid the close contact. Even the hugging's kind of out right now.
Absolutely. But, absolutely. Thank you, Dr. T, for coming back on the show, sharing that boatload of information.
You're welcome.
Now, where can we find you?
Okay, you can find me on social media. You can find me on Facebook in two spots, is probably the best two spots, and that is The Alternative Internist is one spot. And then the other spot is our clinic name, and you can find that at PowerMed, and that's PWRMED, and you can find those on Facebook.
Thank you so much. And you can also find us on Facebook at Nubia Suggs Show. And you can find us on our YouTube channel. Head on over and subscribe at the Nubia Suggs Show. Thank you so much for watching. We'll see you next time. And remember, conversation is queen.